this lecture talk about the flap technique, and I have found one technique to talk about the suture flap. What's the ideal flap for the endoscopic DCR? The question is, can we suture and how to suture? Currently, I always perform two techniques for the suture flap. The first one is about the superior and inferior flap, which I named the jackdaw flap, and the second one is the anterior and the posterior flap. Why I call the name jackdaw flap? I got the idea because I observed the trunk of and the door of the airplane. It needs to be flipped up and flipped down. So the jackdaw flap, first by making the head-shaped incision and create the superior flap and inferior flap. Then the superior flap can be flipped up and the inferior flap can be flipped down. Then suturing the superior flap with the 6/0 wide grip with the 180-degree needle, and then suture and tie with the 2 surgical knots. And to suture the inferior flap would prevent the sum syndrome, and the tie with the surgical knot at the same technique. Normally, the surgeon needs to use both hands, and you can see the tear can flow down as the passenger come down from the ladder. This is the jackdaw flap before and after suturing the flap. And for the anterior and the posterior flap, first make the vertical incision first, and then followed by the horizontal incision. Then the anterior flap can be rotated anteriorly and to approximate with the nasal mucosa, and then suture with the 1/6/0 wide grip, and this one would help for cover the backbone, and suture and tie with the 2 surgical knots at the same. The surgeon needs to use both hands for suture and tightening, and we need the good assistant to hold the camera real well. And then posterior flap can be sutured and tied with the same technique. And this one, normally this need 5 to 10 minutes more for additional to the conventional endo DCR. This shows intraoperative and post-op at 6 months. You can see without the suture flap, the nasal ostium is quite so small, but it's worked well. But with the suture flap, the nasal ostium is much bigger. Conclusion, the suture flap is quite difficult in the narrow nasal cavity, need more learning curve and more experienced assistant. High success rate than the conventional endoscopic DCR by the primary intention healing. Prevent the sum syndrome, and the AP flap is easier than the jackdaw flap, and the nasal ostium is much bigger in the suture flap. Thank you.